My name is Pilar Wise. This is Advanced Health Assessment, the first exam, HEENT, with the focused assessment, and my assessment is musculoskeletal. My patient today is Chuck Wise. So the first thing I would do is walk in the room. I would perform hand hygiene and put on gloves if appropriate. I would introduce myself to the patient. Hey Chuck, my name's Pilar. I am an Auburn University student in the Advanced Health Assessment program. Is it okay if I perform a focused assessment on you today?
Yes.
Okay. Next, I would perform a general survey of the patient. So he appears dressed well for today's exam. He is well groomed. There's no obvious odors. Everything looks appropriate. He appears to be in overall good health. I have noted in his chart before I walked in the room that all of his vital signs are normal. His BMI is normal as well. So next I would inspect his skin, hair, and nails, and I'm going to note that throughout this entire exam I'll be constantly inspecting the skin, hair, everything like that. So I'll start with the skin. I'm going to look at his arms and legs, note for any redness, lesions, tenderness, rashes, wounds, anything like that. I do not see anything at this time. Next I'm going to check his nails and his nail beds, and I'll check for capillary refill, and it is less than 3 seconds, so that is normal as well. Next I'm going to check his hair. Can you take off your hat, please? His hair is thick and full, and I don't see any lice or lesions or anything like that. So next I will this leads into the HEENT assessment. So I'm going to start with his head. It is normocephalic. There's no lesions. I'll inspect the scalp really well. I don't see anything abnormal. You can put your hat back on. Next I'm going to test for cranial nerve 7. So I'm going to have the patient raise his eyebrows. Can you frown for me? Can you close your eyes very tightly? Can you smile? Can you show me your upper and lower teeth? Okay, and can you puff your cheeks out? Okay, so cranial nerve 7 appears to be intact. Next I'm going to palpate and percuss the sinuses. Can you take off your hat again, please? Okay, was there any tenderness or swelling?
No.
Okay, so sinuses are intact. Next I'll palpate the TMJ. You feel any pain or tenderness here?
No.
Okay. Next, I will test for cranial nerve 5. So if you could clench your teeth for me. You feel any pain or tenderness here?
No.
No. Okay, good. Okay, next I'm going to palpate the lymph nodes. So I will start with the back, post-auricular, occipital, preauricular, submandibular, submental. I'm going to do interior and posterior cervical and supraclavicular. Did you experience any tenderness or pain when I was doing that exam?
No.
Okay, so the lymph nodes are all non-tender, movable, and seem to be intact. Next, I will inspect the eyes. So I'm going to grab my ophthalmoscope to use in just a minute. But first, I'm just going to look and inspect the eyes. His cornea is round and intact. There's no obvious redness, drainage, or exudate. I'm going to palpate the lacrimal ducts. There's no swelling, tenderness, anything like that. His eyebrows, eyelids, and eyelashes are all intact as well. So next I will test for cranial nerve 2. So I would perform an eye exam with a Snellen eye chart with a patient, place it 6 feet in front of him. Just for the sake of time, we'll say that we've already done this. This test for visual acuity, and he has 20/20 vision. And next, we would also do the confrontation test to test for cranial nerve 2. To test for cranial nerves 3, 4, and 6, we will check his, this will check the eye alignment and the external ocular movement of each eye. So we're going to do point of gaze. So Chuck, can you cover one of your eyes? Okay, and can you look, I want you to follow my fingers. Okay, can you cover the other eye? Okay, good. So there was no lateral deviation or anything like that, so that was intact. That was the cover test, and we did point of gaze. Next we will test cranial nerves 2 and 3. We're going to check his pupillary response. So I'm going to take the ophthalmoscope, and I want you to look straight ahead, even when the light shines in your eye, don't look at it. I'm going to shine in each eye so I can look at the pupils. Okay, and his pupils are equally reactive to light. Now we're going to check accommodation. So I want you to follow my fingers into your nose. Okay, and accommodation is appropriate as well. So cranial nerves 2 and 3 are intact. So now we're going to do the ophthalmoscope exam. Okay, so I'm going to look in your left eye first with my left eye. Okay. Right eye with my right eye. Okay. His retina was intact. Optic disc and cornea were intact. I did not see any hemorrhages. His red reflex was intact as well. No drainage or exudate. So his eye exam was normal. Macula and the forca centralis were also intact as well. So next we are going to go to the ears. First we're gonna do the next 3 tests to check cranial nerve 8. So first is gonna be the whisper test. So I'm gonna stand behind the patient, whisper something, and I want you to repeat after me, okay?
Cat in the hat.
Okay. Next we're gonna do the Ryan test. This also tests for cranial nerve 8. So I'm gonna strike the tuning fork and assess hearing with each ear. Can you hear in both ears?
Yes.
Okay. So his Ryan test is normal. There's no hearing loss. It seems to be no hearing loss on either side. Next, we're going to do the Weber test. Okay. Can you hear that?
Yes.
Okay. Now I'm going to place the fork like this. Tell me when you can stop hearing.
When I stop?
Yes. Okay?
Yep.
Okay, so air conduction is twice as long as bone conduction. This is a normal finding, so there's no indication that there's hearing loss. We would do this on each ear, but for the sake of time, we're just going to do it on one. So the Weber test is normal as well. And like I said, all 3 of those tests for cranial nerve 8. So next, I'm just going to palpate the auricle of the ear, and I would do this on both ears, obviously, but for the sake of time, we'll just do one. Is there any pain or tenderness
No.
In that? Okay. Next, I'm going to use the otoscope and look into the patient's ear. I would do both ears, but for the sake of time, we will just do one for this assessment. Okay, so there's no redness or swelling in the canal. The cone of light is at 5 o'clock, and the not temporomandibular, the tympanic membrane is intact. It was a grayish color, no redness or swelling, so everything inside the patient's ear looks good. Next, we are going to go to the nose. So I'm just going to inspect the nose. Visually, I don't see any abnormalities. I will palpate. Is there any tenderness when I'm touching? Okay. Next, I'm going to have the patient cover the right ear. So can you cover your right nostril and blow out the left side? Okay, now cover your left nostril and blow. Okay, so the nares appear to be intact. There's no obstructions. He had no problems breathing, anything like that. Next, I am going to assess his nares with the otoscope, and I'm going to look at the mucosa and the septum. I don't see any redness, swelling, or polyps. He just has a slight amount of light colored drainage, which is normal for him during this season. Okay, and then next I will have the patient, I will check I'm going to be checking for cranial nerve 1, the olfactory nerve. So I'd have the patient close his eyes. So can you close your eyes for me? I would put a familiar smell in front of him and ask him to tell me what it is to assess for the olfactory or cranial nerve 1. I don't have an alcohol swab at this time, but I would have an alcohol swab or something very familiar put in front of his nose and ask him to tell me what it is. Okay? Moving on. Next, we are going to inspect the throat. So can you open your mouth for me? I'm going to look at his lips and his tongue, the mucosa. So his mucosa is pink and moist, is intact. Can you stick your tongue out for me? Tongue is intact. Let's see. I'm going to use the otoscope again to look at his uvula and tonsils. Can you say ah?
Ah.
Okay. So there's no deviation or abnormalities in his uvula. The patient said ah. We're going to test for cranial nerves 9 and 10. I could check the uvula and use a tongue depressor to look at that, and also test the patient's gag reflex. But for the sake of this exam, I'm not going to stimulate his gag reflex. But can I have you cough? Okay, so cough and gag reflex should be intact. So cranial nerves 9 and 10 are intact. Next, we will test for cranial nerve 12. So can you stick your tongue out for me, please? And can you move it to the right and to the left? Okay. So there's no, his movement and deviation in the tongue is normal. Cranial nerve 12 is intact. And then cranial nerves 5, 7, 10, and 12 can be checked by having the patient talk and checking for his voice articulation and loudness and everything. So can you tell me your name?
Chuck.
Okay. What year is it?
2021.
Okay, where are you right now?
My house.
Okay, and what did you do today?
I fished.
Okay, good. So his voice is clear. He has no hoarseness. There's no slurred speech, no aphasia, anything like that. So cranial nerves 5, 7, 10, and 12 are intact. Okay, next I'm going to inspect his neck. Can you look up for me? I don't see any obvious redness or swelling or any cyst or anything like that in his neck. I am going to palpate his trachea. Check the trachea. It is midline. There's no deviation. Next, I will come behind you to palpate your thyroid glands. I don't feel any goiter, any nodules or anything like that, so the thyroid is intact. Next, I'm going to check cranial nerve 11, the trapezius and sternomastoid muscles. So can I have you shrug your shoulders for me? Okay, you can put them down. That's intact. And then I'm going to put my hand on your face, and I want you to try to turn towards my hand, push against my hand. Okay, good. So cranial nerve 11 is intact. Okay, so that is all for HEENT. So next we're going to move on to musculoskeletal. Throughout this musculoskeletal exam, I would inspect all of his joints, look at the skin, inspect all the muscle groups. So I'm checking for edema, any abnormalities, anything like that. So I'm just going to quickly glance at the skin. I don't see any obvious lesions, abnormalities, anything like that. Can I see your arms and legs? So all extremities are warm to the touch, and they're pink. There's no discoloration. Can you stick your arms out for me? Okay. I'm just going to assess the skin on the arms and hands. I'm going to check for pain sensation. So I'm going to lightly pinch you on both sides. Can you feel that?
Mm-hmm.
Do you feel pain?
Yeah.
Okay. I'm going to touch lightly. Can you feel that?
Mm-hmm.
Okay. I'm going to strike my tuning fork and see if you can feel vibration. You feel vibration on this arm?
Mm-hmm.
And on this arm?
Mm-hmm.
Okay. All right, and your hands and wrist. I'm going to inspect those as well. Can I get you to squeeze both of my hands? Okay, so I'm assessing grip strength here, and it is strong. Can you put your hands out and make a fist? Okay, open that fist up. Turn them upside down and backwards, and flex and extend. Okay, very good. All right, so his arms and hands are intact bilaterally. He has good range of motion and good sensation. Okay, so next I'm going to get you to, I'm going to inspect your shoulders. So can you raise your arms all the way up for me and all the way back down? Okay, can you put your hands behind your head? Okay, and then behind your back like this. Okay, and then can you touch your shoulders like this? Okay, so it appears that range of motion is good in his shoulders. I'm going to now inspect and palpate his elbows and check for range of motion in those as well. So can you put your elbows up like this? Okay, I'm going to check for the extratrochlear lymph nodes right here. Do you feel any tenderness?
No.
Okay, there's no swelling, they're non-tender and freely movable, so those are intact. Okay, can you put your arms out for me like this? Back up and all the way down. And can you put them like this? I'm going to get you to push against my hands. Okay, good. So he has good strength in his elbows, range of motion is intact, grip strength, everything is good. Okay, next we're going to check range of motion in your hips. So if you don't mind, I'm going to have you stand for me really quick. Okay, I want you to move your hip to the left, okay, and to the right. All right, and then back and flex forward. Okay, now you can sit for me, and I want you to see if you can extend each leg using your hip. Okay. Okay, now extend both legs. Okay, good. Okay, so range of motion in his hips is intact. Now we're going to check your range of motion in your knees. I'm going to inspect your knees and palpate, and everything feels normal here. So can you raise this leg up and push it out for me? Good. Okay, same with your left leg. Raise it up and extend. Okay, now I'm going to, I want you to raise your right knee up and try to push against my hand. Okay, good. And same with the left. Okay, good. All right. And then now we're going to, I'm going to inspect and palpate his ankles and his feet. So everything appears normal here. While I'm down here, I'm also going to inspect his hairline, his veins. I don't see any like varicose veins or signs of PVD or PAD. His hairline is normal. There's no lesions, abnormalities, anything like that. Now I'm going to get you to stick both of your feet out. Okay, and can you flex your toes? Okay, and push them all the way out. And can you move them inward? Okay, and outward. Okay, good. So the patient also has good range of motion in his feet and ankles as well. And I believe that includes the musculoskeletal part of this exam. So Chuck, thank you so much for being my patient. And that includes the HENT and the musculoskeletal system here.